Okay, so one more time. The heart is located within the pericardial cavity, uh, in the pericardial cavity within the mediastinum. Now, there are other couple of other ways you can explain where is our heart located. Uh, the easiest way is, as I beginning of the class, you said that heart is located on the left side. We're going to add that a little bit, like heart is located on the left of the midline, or you can say it is anterior to the vertebral column and posterior to the sternum. That means it's behind sternum, but it's in front of vertebral column. And heart is located between the second and the fifth rib. So your heart is slightly tilted towards the left side. If you notice that, slightly tilted towards the left side. And interestingly, this is the apex of the heart. Remember, in the lung, this is the apex of the lung, because the name apex come based on like where the name apex come based on like what the shape of that looks like. So the shape of the apex is like, the word apex means like the top of the mountain, if you consider that. So in case of lung, that's their apex, but in case of heart, that's the apex. So we can say heart is like kind of like upside down. So the base is right over here, heart, and the apex is right over here. Okay. Then comes the important part that you learn in ANP1, that is called the serous membrane. So the heart, as I said, it's in the pericardial cavity. So obviously pericardial cavity is surrounded by a serous membrane. We learn in ANP1, it's called pericardium. Pericardium. Okay, so that's the name. So that's the word, the serous membrane, pericardium. Now, the heart is surrounded by pericardium. Now, pericardium has two layers. The parietal layer, which is the outside one, the visceral layer, that's the inside one. So if you look microscopically, let's say you look at this area microscopically, right, this big, this side, that's a serous layer. So that's the outermost part is called parietal, innermost part, we call them visceral. But now pay attention to this one. Outside, so if this is the heart, if this is the heart and it is covered by a pericardial membrane like this is the visceral pericardia, that's the parietal pericardium. Now when it is covering them, it looks that this is how it looks. It looks like the outer wall of the heart and the inner side of the pericardium like together. So some book sometimes use the word epicardium is the outer layer, which is nothing but the visceral layer of pericardium. So you can literally interchangeably, you can use that. So heart itself, this heart itself has three layers. The wall of the heart has three layers: epicardium, myocardium, and endocardium. Epicardium, myocardium, and endocardium. So the innermost layer is the endocardium. Myo, the word means muscle. So that's the middle layer, myocardium, made with muscle. And the outermost layer is called epicardium. As I said earlier, epicardium can be also referred to as visceral pericardium by some book. They use that interchangeably. So these are the three layers. So epicardium, myocardium, endocardium. You must know which one made by what, particularly the myocardium, which is a cardiac muscle layer. So at this point, you should know that how cardiac muscle cell looks like. Cardiac muscle, skeletal muscle, smooth muscle. Muscles are three types, ANP1. Cardiac muscle, unlike skeletal muscle, does not have multinucleated cells, and cardiac muscles also have one extra thing that's called intercalated disc. So if we look into a microscopic structure of the cardiac muscle is kind of braided, so the cells come close to each other, and then they create those dark lines. So if I put two pictures here, both are exactly like same microscopic picture. So either you look at here or here, you'll see that dark line appears between two cells. Those are nothing but junctions between two cells, and those junctions takes up a little bit extra dye. If you do remember, muscles, skeletal and cardiac both, are like banded pattern. They are light band, dark band, light, dark, light, dark. You remember those? You remember those like A band and I band. So these muscles all have dark light pattern, the banded pattern. But when the cells come in the junction, these junctions takes up additional dye, and they appear a little bit darker in the microscope. Under the microscope, we call them intercalated disc. So the question is, what is intercalated disc? The answer is they're nothing but the gap junctions, that nothing but the gap junction between two cardiac muscle cells. So that's the biggest difference between a skeletal muscle and cardiac muscle. So if you see a slide under the microscope, just by identifying intercalated disc, you should be able to identify cardiac muscle, because skeletal muscle, although banded pattern, does not have, they don't contain any intercalated disc. Inner layer, endocardium. Endocardium, those are basically modified endothelial cells, and they are going to also make the heart and the inside the heart valves. So we are going to talk about heart valves a little bit later. So now the question is, like, in order to understand the heart structure better, what we need to know is how the blood flows through the heart. Because bottom line is, heart act as a pump. So if you know how blood flowing through the heart, you know 90% of the heart structure. So that is why before we learn heart structure, we should know how the blood flowing through the heart. So what happened is, in the body, let me teach you using using a piece of paper. Okay, so in the body, what happened is, in the body, heart is a pump. So I'm going to draw a simple pump. So let's say this is a pump. This is a pump. We know a pump job is they suck the liquid from one side and push the liquid to the other side. So let's hypothetically saying, let's say the liquid comes within the pump this way. So the liquid entered the pump right here. And let's say the liquid is going out from the pump right here. Same as like your pump in the basement. Okay. So the liquid coming here, they dump it over here and the liquid go out. So now let's assume this is a heart. So what they're doing, they're pumping the fresh blood. I'm using the word fresh, indicating that that blood contains more oxygen to the body, everywhere, head to toe. So this is your body, head to toe. So the fresh blood, again, fresh means high amount of oxygen. So oxygen-rich blood come to the body. We know body use oxygen and they produce carbon dioxide. So when they produce carbon dioxide, that goes into the blood again. So this is carbon dioxide rich blood, or we can say oxygen poor blood, or so-called oxygenated blood, deoxygenated blood. So heart is a pump, so that's your pump. They're pumping the oxygenated blood, fresh blood, to the body, head to toe, with all the blood vessels. Body takes them up. Once they use them, they put carbon dioxide rich blood out, which is so-called deoxygenated blood, and that comes back up to the heart. Now the problem, heart cannot pump back the same blood because it's already deoxygenated. So what heart needs to do? Heart needs to refresh the blood. I'm using the word refreshing, meaning we need to get rid of the carbon dioxide, which is in the blood. We need to mix with the fresh oxygen. So what heart does is, heart sends this blood to another organ where the refreshment takes place. So heart takes this and sends this blood to the organ called lungs. We already know that chapter very well. What lungs does, so heart sends the blood right there, goes to the lung. What lung does, lung gets rid of the carbon dioxide and put fresh oxygen in. That's external respiration or gas exchange. Then this fresh blood, or again, oxygenated blood, come back to the heart. So this oxygenated blood come back to the heart. So this blood come back to the heart again. So one more time. Then this oxygenated blood will be pumped by the heart to the body. Then body use them. They use oxygen, more carbon dioxide. So carbon dioxide rich or oxygen poor blood will return to the heart. Heart send this blood back to the lung. Lung get rid of the carbon dioxide, put oxygen back in the system. It comes back to the heart pump it again. That's it. That's basically two circuits here. One between the heart and the body right here, and one between the heart and the lung. So heart and the lung, the circuit we call pulmonary circuit, and heart in the body, we call that circuit systemic circuit. So pulmonary circuit and systemic circuit. Systemic circuit, heart and the body, pulmonary circuit, heart and the lung. One more time. Heart pumping the blood, fresh oxygenated blood to the body. This is the key of the chapter. The body using them, they use the oxygen to get rid of the carbon dioxide. Carbon dioxide rich blood comes out, return to the heart. Heart doesn't want to pump the same blood because that makes no sense. So they are going to send the blood to the lung for a refreshment, getting rid of carbon dioxide, put more oxygen back in the system, oxygen-rich blood come back to the heart. Heart pump that's back again. Now we know liquid can get mixed up. So to prevent that, heart make themselves like 4 chamber. So they do not get mixed up at all. So they have literally 4 chamber with some opening which is controlled by valve. So they don't get mixed up. That's exactly what it looks like on the top. So again, remember from body, deoxygenated blood coming back to the top right atrium. That's exactly where it is, right atrium. Then right atrium. So now we know there are 3 veins brings the blood back to the right atrium. On the top, superior vena cava. On the bottom, inferior vena cava. So they come from 2 different, and in the heart itself. Remember, heart muscle requires blood as well. So from the heart, from the back side of the heart, there is a pipeline that brings it right over here. That's called coronary sinus. So we have superior vena cava, inferior vena cava, and coronary sinus. This sinus is also a name of a vein. So these are the 3 veins that brings back blood to the right atrium as discussed previously. So right atrium received the blood. Then what they do? They drop it down to the right ventricle. So the literally blood goes right over here. There is an opening here. So the blood drop it down to right there in the right ventricle. Right ventricle, what they do? They send the blood back to the lung. That's exactly what they do. They have a pipeline attached right over here. They have a pipeline attached right over here. That's called pulmonary trunk. It is going away from the heart. So that is an artery. By the way, blood vessel major, artery and vein. This is how we define artery that's going away from the blood, away from the heart, artery, and vein, they're visiting the heart. So that's going towards the heart. So blood vessel name based on which direction they flow, not what they carry. Some people often do mistake saying that artery carry oxygenated blood, vein carry deoxygenated That is partly true because there are some artery, they carry deoxygenated. This is the one example. There are some vein, they carry oxygenated blood. So we do not name the artery and the vein based on what they carry. We name them based on which way they carry. So the direction of the blood flow. So the artery, they're flowing away from the heart. Vein, they are going towards the heart. So this will be an artery because they're going away from the heart. So this right ventricle pump the blood to the lung. So they go to the lung. So they bifurcate. One goes to the left side of the body. One goes to the right side. So they will continue. This is back of the superior. They will go to this side of the body. So those are the two pulmonary artery. Left pulmonary artery, right pulmonary artery. This one sometimes referred to as either pulmonary artery or because it is the beginning part, we call them pulmonary trunk. It goes to the lung. Lung, we know, refresh it, get rid of the carbon dioxide, get back oxygen. That's respiratory system. We studied that. Now they're coming back. From the lung, they come back to the left atrium. That's the left atrium. So they're coming back to the left atrium. How? There are 4 veins. Remember, vein go towards the heart. So 2 veins come from this side of the body. That means from the left lung. 2 veins come from the right lung. So 1 and 2. Those 2 go back of the heart and pop up somewhere here. They go back of the heart and pop up right there. So these are the 2 veins. These are the 2 veins. Those are called pulmonary veins. These are left pulmonary veins. Both of them named same. And these are called right pulmonary veins. Both veins, like both paired of veins, all 4 bring the blood back to the left atrium. Same thing, opening right here, the blood drop it down right there. Simple. So the atrium, they pump a little, the blood comes right there. Atrium does not need to pump very hard because normally liquid flows down and the downstairs or below based on gravity. They can gently push it so that blood is right here. So now your blood is here in the left ventricle. Left ventricle is a very strong pump. So they now pump the blood. Excuse me. So there is a huge artery, again, artery. There's a huge artery. They go up like this. They go from this side, like the left ventricle, go up like this, make a bend. So they make an arch like that. And then they go down below, back of the heart, and they continue like this. So this huge artery, which is the greatest artery in the body, we call them aorta. Aorta, the greatest or the largest artery of the body. And we learned in the blood vessel chapter that aorta make branches, 3 branch here. If you do remember, left subclavian artery, right over here, we call left common carotid, and right over here, we call brachiocephalic trunk, which is then become right common carotid and right subclavian artery. Practice that part at home later on. But bottom line is, aorta is going to take blood every single place of the body, right here. Aorta going to take blood every single part of the body. Body using them, taking out oxygen from the blood, adding carbon dioxide, return to the heart. How? Inferior vena cava, superior vena cava, coronary sinus, 3 of them. Blood is in the right atrium, drop it down to the right ventricle. Pulmonary trunk, send it to the lung. Lung, refresh it, respiratory system. Pulmonary veins, right and the left pair, bring it back to the left atrium. Left atrium, drop it down, left ventricle, pump the blood into the aorta. So the aorta right over here, we call this like ascending aorta, going up. Aortic arch, arch means bent. Descending aorta, going down. They make branches here, here, here in the abdomen and all the way to the body. That's it. So we have one more time from the left ventricle, pump the blood to the aorta, it goes to the body. Inferior vena cava, superior vena cava, and coronary sinus, they bring the blood back to the heart right atrium, drop it down, right ventricle, pump into the pulmonary trunk through the pulmonary artery, going to the lung, pulmonary veins coming back. Once again, artery and vein, the name depend on which direction the blood flow, not what they carry. Once they're right here in the left ventricle, left atrium, they drop it down to left ventricle, pump it to the aorta, going to the body. So now we know this is right atrium, this is left atrium, this is right ventricle, this is left ventricle, that's pulmonary trunk, that's aorta, superior vena cava, inferior vena cava, pulmonary veins, etc. Two more things I already mentioned. These are the between the atrium, the septum of the wall called interatrial septum, between the ventricle, the septum is called interventricular septum. The lots of muscles are here. So when you look at the picture, you can easily identify left side and right side by looking at the thickness of the muscle. The left ventricle, the muscles are much thicker because they are the stronger pump. They're pumping to the body. Right ventricle muscle does not need to be that big because they pump it to the lung. Lung is neighbors for the heart. So they do not need to be a great pump. This has to have a lot of strength. Okay. Now comes the valves, because all this discussion is like one directional flow of blood. So blood comes from here to here, right atrium to right ventricle, then to pulmonary trunk. So when the right ventricle pump, the question is why the blood is not going backward. Same thing here. When the left ventricle pump, why the blood is not going backward? Why they go here? Because there are some valves right here and right here. Those two valves between atria and ventricle, we call them atrioventricular valves. Atrioventricular valves are AV valves. Two of them between left atria and left ventricle, which is this. The valve is called bicuspid. Bicuspid. Cusp means like flap. So this is bicuspid valve, meaning they have two flap like this. This is bicuspid. Bicuspid, two caps, like two flap. Like if you imagine this is like a door, boom, bicuspid. Tri means you have another one. So two and a third one. So tricuspid is between right atria and right ventricle. That's tricuspid. So their valve look like this. They have 1, 2, 3, tricusp. So these two valves controlling the one directional flow. That means when the ventricle, whether it is right or left, when they are pumping, these valves are closed. So that blood cannot go backwards. So blood cannot go backwards. So sometimes in case of left ventricle, as I mentioned, they're a very strong pump. If the valve does not close for some people properly, the little bit of blood can go backwards and create a regurgitation noise, like a gurgling noise. We call them heart murmur. So those people who are blood is leaking a little bit, it's not a big deal. If it is leaking a little bit, they can survive and have a normal life. That they have heart murmur. But when they're not properly function, that's a trouble. Then we have to replace the valve and so on and so forth. Then there are two more valves, right underneath the aorta and right underneath the pulmonary trunk. Why? Pay attention. Let's say left ventricle, they pump the blood. Once they pump the blood goes here, that's fine. Then it's like a pump. So once they pump the blood goes, then they relax. So when the left ventricle relax, they will kind of like suck the blood back because they create a vacuum. So the blood initially flow this direction and then literally goes backwards because the ventricle is now relaxing. When they relax, they kind of like sucking the blood back. It's like if you're using a dropper, okay? So you press it, the ink goes this way or any other liquid, and as soon as you let it go, they will suck back the liquid. Same thing here. So once they press, the liquid goes here. Same thing here. When they press on the right ventricle, the liquid means the blood flows into the pulmonary trunk. But when they release or relax, they will suck it back. So the fluid will coming backwards. That is why we have two pressure, systolic and diastolic. The word systole means contraction. The word diastole means relaxation. So in the heart contract, meaning heart systole, the blood goes with a lot of pressure. Then when heart relax, diastole, the blood comes down a little bit. That's why often we are going to talk about that later on in a little bit more detail. Often we call like your blood pressure is 120/80. This is the systolic pressure. This is the diastolic pressure. It means when the contraction, blood pressure is very high. When the diastole, the blood pressure comes low again because they're pulling them back. Okay. So to prevent that flow back to the ventricle, we have a valve right here. So these two valves, we call them semi-lunar valve, semi-lunar, half moon. That's how they look like. That's why the name semi-lunar valve. So this is aortic semi-lunar valve, aortic semi-lunar valve, or some book just called aortic valve. This one, pulmonary trunk semi-lunar valve, or some books simply called pulmonary valve. So pulmonary semi-lunar valve or pulmonary valve. So these four valves, two AV valves and two semi-lunar valve, ensure that all the movement of the blood we just discussed about the pulmonary and systemic circuit must be one directional. Now there is one last question remaining. So let's assume this is a valve. So right here, my hand, that's a valve. So when the valve is open, blood goes here. Got it. So blood is here, valve open, blood goes here. Now when the blood is, the flap is closed, now when the bottom part, this ventricle pump, so they will open up like this. The valve opens up towards that. But why actually it doesn't open up towards the side? The question is why the flap is not opening up on the reverse side. Like why it is not reversing so the blood can push it back. So there must be some mechanism preventing them from going this way. The mechanism is there's some string attached underneath. So right here, if you have a valve, so let's draw a fresh picture right here. So let's say this is the valve. This is the valve right there. They have some string attached to that valve. Those strings are attached to the muscles, like muscles are like this. So those strings are much attached to those muscles. So these strings are commonly referred to as you guessed, heart string or string of heart, although we are not going to follow the name. Those strings are called cordae tendinae, like a tendinous cord. And these muscles, these are cardiac muscle, but these are a little bit better shape. These are called papillary muscle. The ups and downs, the papilla, the word means nipple. So they're shaped like that. That's why the name papilla. So these are muscles are called papillary muscles. And the strings are called cordae tendinae. So whatever I discuss right here in this page, I am going to discuss that using the slide one more time. So let's go back right here. So systemic circuit means from the heart, the blood goes to the systems of the body, meaning the entire body, coming back to the heart. Pulmonary circuit means blood goes to the lung and coming back to the heart. Blood vessels, arteries, and veins, we already discussed. Arteries goes away from the heart, veins carry back of the heart. That's why most, not all, carry oxygenated blood. This is again the same thing, the pulmonary and systemic circuit. This is the chambers of the heart. So let's go around here. That's the right atrium. Right atrium, superior vena cava brings the blood here, inferior vena cava brings the blood here, and on the back side, you cannot see it in this particular picture, but if you turn it around, this is not this one, this should be this one. It's called coronary sinus. That's the blood, that's the vein that brings the blood back to the right atrium. So right atrium receives blood from three veins, do not forget. Superior vena cava, inferior vena cava, coronary sinus. Coronary sinus is not visible in this picture. I'll show you another picture later on. So now, right here, they go down into the right ventricle. Right ventricle, they pump to the pulmonary trunk. Now, when they're going down, there's a valve between the right atrium and right ventricle. The valve is called tricuspid valve. The valve is attached with those strings. Those strings are called cordae tendineae, or simply tendinous cord. And those cords are attached to these muscles. These finger-like muscle or finger projection or like a nipple-like muscles are called papillary muscle. That's what the word is, papillary muscle. This is papilla. Same thing with the left side. This valve right here, so from the right atrium, tricuspid valve, right ventricle, this valve is called pulmonary valve or pulmonary semilunar valve. Take it to the pulmonary trunk. Then we go into the left pulmonary artery, right pulmonary artery, goes to 2 lungs, come back with 4 veins, left pulmonary veins, right pulmonary veins, bring it back to the left atrium. Left atrium, drop the blood through a valve called this one, bicuspid valve. By the way, bicuspid valve has another name called mitral valve. Mitral valve, okay? And then same thing, cordae tendineae, papillary muscles, and then they pump back. So they pump back through right here, a little portion, we can see it, aortic valve that goes into the aorta. Then aorta is ascending aorta, aortic arch, descending aorta. And this wall between the ventricle we call interventricular septum. This wall between the atria we call interatrial septum. That's it. That's the structure of the heart. One additional feature, because it looks like apparently that ventricle is larger than the atria, but that is not the case, because whatever blood comes right here, the same amount goes right here. Same is true for the left side. So this place, they have a wrinkle end. This picture does not do the justice to this picture, concept, but there are some other picture you will see. There's like a wrinkly thing attached. It's like extension attached. So when the blood comes in, they kind of like a pop up. They kind of pop up a little bit. So this extended area is called auricles. This extended area, so this side extended area will be called right auricle. On the same thing on the left side we call auricle. Auricle literally means like extended area. So that expandable area of the atria are called auricles. This slide is taken from, I believe, your book, and the numbering will help you out exactly the way we studied. So they start from right atrium. So right atrium blood enters right atrium from superior and inferior vena cava, and also please add that coronary sinus, 3 of them. Okay, some books they just don't mention this. Then blood enters through the AV valves. Right side we call tricuspid valve right here. Number 2, 3. The right ventricle contract goes through the pulmonary trunk or goes to the pulmonary trunk through the pulmonary valve right here. Number 3. This goes to the pulmonary trunk, then it's bifurcate. 1 goes to the left lung, 1 goes to the right lung. So those number 5 is going to the lung, where it unloads carbon dioxide, loads back oxygen, where it unloads carbon dioxide, loads back oxygen, coming back through pulmonary veins, 2 of them here, 2 of them here. Right pulmonary veins, left pulmonary veins comes right here into the left atria. Through the mitral valve or bicuspid valve, it comes to the left ventricle. Pump goes through the aortic valve into the aorta through the body. That's exactly what is explained here. Make sure you go over that, to try to draw the picture as I did, so that not only you know the the flow of the blood through the heart, you also would know what are the structure of the heart. And these are both the circuits mentioned, pulmonary and systemic. We talked about that multiple times. These are the valves. So 2 AV valves. So these are 2 flap, 1 flap, 2 flap. Bicuspid, there are 3 flap, 1, 2, 3. The tricuspid, they look like half moon shape. That's why it's called, both of them have 3 flaps, but they look like half moon shape. That's why it's called semilunar valve. These are, again, showing how the valves works, and that's it. That's basically the structure of this, same thing, the valve. That's basically the structure of the heart. This last picture will explain what coronary sinus is. So before we go to that coronary sinus, this is important. right here at the bottom of the aorta. Very important to understand that. So when the aorta is getting the blood pumped by the left ventricle, the bottom of the aorta, these arteries are called coronary artery. Left side, left coronary, right side, right coronary. Coronary artery, meaning those two arteries are then branched out obviously more. They are going to supply blood to the heart muscle. Heart muscle require blood because heart muscle cannot function without blood. That's why one of these arteries, like when one of these arteries get blocked, we call heart attack. So when these arteries are blocked, that means this portion of the heart muscle will not receive any blood supply. They will have oxygen less. And without oxygen, cardiac muscle cannot function. And that's so-called myocardial infarction or heart attack. Okay. So now how they return back? So all these arteries then come back to the vein, and then this is the largest vein right here called coronary sinus that brings back blood to the right atrium. So they literally poke into the right atrium. So right atrium receive blood through coronary sinus, through superior vena cava, through inferior vena cava. So cardiac muscle, how they get energy from? So the cardiac muscle, they need energy all the time. They need to make tons of ATP. A little bit you studied in the ANP1, not a little bit actually, the full chapter called metabolism, like glycolysis. So when glycolysis, Krebs cycle, all these things, this is basically here. But we are going to learn that metabolism later on anyway. So right here, you're going to focus on cardiac muscle depends on aerobic respiration, meaning they need oxygen, as I just described, and they get oxygen by respiratory system, and then they get glucose, which we can break down glycogen also to get glucose in the cell, and then they undergo glycolysis, Krebs cycle, electron transport chain, all these three words that you learn in ANP1 to make energy. They can also use a little bit of fatty acid and ketone or other lactic acid stuff. They can also use a little bit, but mainly they use the fatty acid and the glucose, okay?